Glaucoma is often called the silent thief of sight, and for good reason. Its warning signs can be easy to miss. So how do you know when something's wrong? Let's talk about the symptoms of glaucoma you should never ignore. I'm Dr. Constance Okeke, your host. In this video, we will talk about the symptoms of glaucoma. Common questions I hear. What are the symptoms of glaucoma? To answer that, it's important to know that there are two main types of glaucoma, and they can look very different. Acute angle closure glaucoma is less common, but develops suddenly and painfully. If you ever experience severe pain or pressure, sudden blurred vision, halos around lights, eye redness, headache around the eye, or even nausea and vomiting, go straight to the emergency room. This is a medical emergency and can cause permanent vision loss within hours. Earlier subtle warning signs could mimic sinus pressure, especially upon awakening from sleep. Open angle glaucoma, on the other hand, is by far the most common type, but it's much trickier because it usually develops silently with no pain and no early warning signs. That's why it's often called the silent thief of sight. So what can you watch for? Loss of peripheral vision. That's your side vision, what you see out of the corner of your eyes. Blind spots, small missing patches in your vision that may show up without you realizing it. Tunnel vision in later stages, when only a small central area of vision is left. Let me share two patient stories that show how subtle this can be. One patient, who was a skilled basketball player, started missing passes years before his diagnosis. He thought it was just aging, but in reality, glaucoma was already stealing his side vision. Another patient, who loved driving, noticed he was checking around more often on the road and losing confidence at night. One rainy evening, he realized he could no longer trust his vision to drive his child safely. That's when he sought help. Others have told me they bump into objects or clip the side mirror of the car, not really realizing their vision loss was from glaucoma. These changes can be so easy to dismiss, but they may be the first signs of serious disease. So here's the key takeaway. If you notice changes in your vision, even small ones, don't just write them off as getting older. With early detection and treatment, most people with glaucoma do not go blind, but the earlier we find it, the more we can do to protect your sight. If you're worried about your vision, schedule an eye exam and talk to your doctor. In our next video in the Glaucoma Patient Journey, we will walk you through what to expect during a glaucoma screening eye appointment, so you'll know exactly how doctors detect the disease early.